Infertility is defined as the absence of pregnancy within 1 year despite regular and unprotected intercourse. However, if pregnancy does not occur despite regular and unprotected intercourse in women over the age of 35, necessary tests and treatments can be started earlier. Infertility can be seen in 10 to 15 out of every 100 couples of reproductive age. The incidence increases with increasing age. Infertility is a health problem related to the reproductive system. It can be due to a single cause or a combination of several factors. Infertility is a disease of the reproductive system that impairs the body's ability to fulfill its reproductive function. There are many safe and effective treatments to overcome infertility. These treatments increase the chances of couples having a baby. The cause of infertility can be either male or female, and in 10 to 15% of the patient group, despite all the research, no cause can still be found. Although having a child is perceived as a simple and natural function, this process is actually quite complex. In order for pregnancy to occur, all of the following factors must be met. These are: healthy egg production by the woman, production of quality sperm by the male, healthy fallopian tubes that allow sperm to reach the egg, fertilization of the egg by sperm. The fertilized egg can implant in the uterus. Adequate embryo quality. Infertility can be caused by male or female causes. However, studies have shown that in 10 to 15% of patients, no cause of infertility can be identified. In general, 85 out of every 100 couples who regularly have sex 2 to 3 times a week conceive within 1 year, and the majority of the remaining 15 couples conceive in the second year without the need for treatment. However, as women get older, their chances of fertility decline significantly. Although this decline is not very pronounced until the ages of 32 to 35, it rapidly becomes apparent especially after the age of 38 and by the age of 40. Fertility losses of up to 75% are observed. In this respect, gynecological evaluation of women who are over 35 years of age and have infertility problems for more than 6 months should be performed without delay. In men, the effect of age on fertility is not as pronounced as in women. The causes of infertility are generally shared 50% to 50% between men and women. In the remaining patient groups, factors arising from one of the male or female partners account for 35% for each partner, and factors arising from both partners account for approximately 20%. Some of the factors that can cause infertility can be categorized by gender as follows. Many factors can lead to poor fertility. The most common causes of male infertility are abnormal sperm production, function, and sperm morphology. General lifestyle can influence these factors. The causes of infertility in men are: decreased sperm count and motility, structural problems of sperm, no sperm cells in semen, azoospermia, canal blockages, sperm not coming out, ejaculation into the bladder, hormonal causes, undescended testicle at birth or after birth, febrile diseases in childhood, diseases such as mumps in adolescence, genetic diseases, varicocele, enlargement of the veins leading to the testicle, diseases such as syphilis, gonorrhea, sexual dysfunctions, such as erectile dysfunction and premature ejaculation, diabetes, previous cancer treatment, infections, testosterone deficiency, excessive smoking or alcohol consumption, stress. The most common causes of infertility in women include tubal obstruction, endometriosis, chocolate cyst, ovulation disorders, polycystic ovary syndrome, and early menopause. Causes of infertility in women: destruction or blockage of the tubes, irregular menstrual cycle, decreased ovarian reserve, obstruction or adhesion of the fallopian tubes, previous infections or intra-abdominal operations, Endometriosis. Endometriosis is defined as a condition in which the endometrium, which is found in the lining of the uterus and sheds out every month in the form of menstrual bleeding, settles somewhere in the body outside the uterus and affects the function of the ovaries, uterus, or fallopian tubes. Ovulation disorders. High prolactin level. Polycystic ovary syndrome. Because in this condition, the body produces too many androgen hormones, which affects ovulation. Polycystic ovary syndrome is also related to insulin resistance and obesity. Early menopause. Uterine fibroids. Fibroids are benign tumors located in the uterine wall. Intra-abdominal adhesions. Adhesions formed after pelvic infection, appendicitis, abdominal or pelvic surgery. Thyroid problems. Disorders in the thyroid gland, such as too much or too little thyroid hormone secretion, can affect the menstrual cycle and cause infertility. Cancer history and cancer treatment. Cancers, especially in the female reproductive system, can cause infertility. Radiotherapy and chemotherapy can also affect a woman's ability to reproduce. Other medical conditions. Conditions such as late puberty, missed periods, liver disease, diabetes can also cause infertility in women. Caffeine intake. Excessive caffeine consumption can also lead to infertility. Obesity. Excessive smoking and alcohol consumption. Sometimes fertility is reduced due to more than one factor, and sometimes no cause for infertility can be found. What are the symptoms of infertility? There are reasons that can be shown among the symptoms of infertility, but all these symptoms are insufficient to make a definitive diagnosis of infertility. In order to diagnose infertility, certain tests and results are needed. Some symptoms include the following: menstrual irregularities or no menstruation at all, severe pain and cramps during menstrual periods, as well as intense and excessive bleeding, milk coming from the breasts when not pregnant, excessive hair growth and acne problem, which may also be due to excess weight and hormone disorder, problems with erection and ejaculation in men, pain, swelling or swelling in the testicles, very little semen in men, lack of pregnancy in young couples after 2 years of unprotected sex, in couples over 35 years of age, no pregnancy within 1 year despite not using contraception. In couples over 35 years of age, the chance of pregnancy decreases due to the decrease in the efficiency of the reproductive organs due to their advancing age. Therefore, it is recommended that these couples who do not have much time for pregnancy seek professional support if pregnancy does not occur despite regular unprotected sexual intercourse. Diagnosis methods. In case of failure to conceive despite regular unprotected sexual intercourse, different tests are used in men and women in order to identify a cause and make a diagnosis. In men, one of these tests is semen analysis, spermiogram. After 3 to 7 days of sexual abstinence, a sperm sample is taken and examined under a microscope. The semen analysis provides information about the sperm count, motility and structure. If necessary, anti-sperm antibody can also be added to the tests. In women, if the menstrual cycle is regular, blood tests may be requested to check whether ovulation has occurred within 7 days before menstruation. In some cases, your doctor may want to monitor egg development and ovulation with ultrasound tests for 1 month. FSH. LH and estrogen levels can be checked between days 2 and 5 of menstruation to evaluate egg quality, and AMH levels can be checked with a blood test to evaluate ovarian reserves. Whether the fallopian tubes are open or closed can be checked with an X-ray called HSG or, in some cases, this may require laparoscopy with a telescopic camera inside the abdomen. How is infertility treated? IVF, in vitro fertilization, is the most well-known fertility treatment. But there are other treatment methods that can be recommended for couples who have difficulty conceiving naturally. The decision on which method to recommend is made after the condition of the woman's fallopian tubes and egg quality and the man's sperm evaluation, accompanied by information such as the age of the partners, whether there has been a previous pregnancy, how long they have been trying to get pregnant.